welcome to webinar series from Happiest Health. Happiest Health is a global health and wellness knowledge enterprise which brings to you a series of webinars on various health topics.
I'm Revati Rajavan from the Happiest Health team, and I will be the moderator for today's session titled, Is Brain Training the First Step to Beat Alzheimer's? Alzheimer's is a progressive neurological disorder and the most common cause of dementia. It affects memory, thinking, and behavior. Symptoms eventually grow severe enough to interfere with daily tasks. Many people engage in brain training in the hope that keeping their brains active will maintain or improve their cognitive abilities as they get older. Brain training includes activities to challenge the brain. It could be crosswords, Sudoku puzzles, computer games, and many more. One of the largest studies conducted to date testing computer brain training was funded by Alzheimer's Society and involved almost 7,000 people over the age of 50. The brain training package tested in the study challenged people's reasoning and problem-solving skills. The results showed that using this brain training package resulted in improvements in reasoning and remembering words after 6 months. The more the exercises were completed, the more likely participants were to see improvements in these brain functions. But do these brain training activities just reduce the risk or prevent Alzheimer's altogether? We will discuss this and more with our panel of experts who have joined us today. Join me in welcoming Dr. N. Venkataramana. He's the founder, chairperson, and chief neurosurgeon at Bangalore Regenerative Advanced Institute of Neurosciences, or BRAINS Super Specialty Hospital. He is a treasurer for the Asian Australian Society for Pediatric Neurosurgery and executive member of the International Federation of Neuroendoscopy. He has also been the director of Manipal Institute of Neurological Disorders and assistant professor of neurosurgery at NIMHANS Bangalore in the past. He has performed over 30,000 surgeries over the past 30 years. His special interests include microneurosurgery, endoscopic neurosurgery, pediatric neurosurgery, cerebrovascular surgery, and many other areas of interest in this particular field. A warm welcome to you, Dr. N.K. Venkataramana, to this panel.
Thank you very much. Thank you very much.
Next up on the panel, we have Ms. Ramani Sundaram. She's the lead for research, training, and development at Nightingales Medical Trust, a dedicated neuroscience professional with 6 years of work experience in dementia care and management. She has designed and managed dementia and elder care projects, undertaken clinical training in neuropsychiatric assessments, care analysis, and planning. She's a physical and cognitive activity trainer. Welcome to the panel, Ms. Ramani Sundaram. Next up on the panel, we have Mr. C.V. Sastry. He's a senior citizen and member of the Active Aging Group. By profession, he's a retired Deputy General Manager from Hindustan Aeronautics Limited. Welcome to the panel, Mr. Sastry.
Thank you.
A warm welcome to all the panelists once again and attendees who have joined in today. As we begin the discussion, I'd like to split this session into two in terms of the content of our discussion. Initially, I would like to understand the Alzheimer's condition and then move on to brain training and then focus on the relation or the link between these two. To start off with, I'll go with you, Ms. Ramani. What are the typical signs that a person affected with Alzheimer's show, and what can family members notice?
Right. First of all, thank you. Thank you so much for having this panel discussion. I think it's very much the need of the hour. Not many people discuss about dementia nowadays, and the more awareness that it's getting is really nice. So Alzheimer's is the most common type of dementia. So dementia is more of an umbrella term that we use, and Alzheimer's is the most common type of dementia. And if we see the early signs of Alzheimer's that family members can notice is, of course, first would be the recent memory loss. There will be, there'll be loss of memory in terms of what they did yesterday, what food did they have as breakfast, whom did they met in the park when they were going for a walk, were they able to remember the name? So these are few things that will start initially when it comes to memory. There'll be misplacing of things, which is, of course, a very good alarm sign when it comes to early sign of Alzheimer's, because they're forgetting, they keep their things here and there, and there'll be suspicion that somebody actually took away those things because they don't remember. There'll be difficulty in performing familiar tasks. So a particular person might be knowing how to use a remote or a mobile. They might find difficulty in executing those familiar tasks that they were able to do. There'll be disorientation about time and place. where they were yesterday or where they are. They might get lost while coming to the home, while going for a walk. So these are few of the early signs. And in terms of personality and behavior also, sometimes family members can notice that there is a change in personality and behavior. They might be more irritated, or they might start having some delusional or hallucination thoughts. Or there could be also, one of the things that happens is when they have difficulty in performing familiar tasks, they may become more introvert and stop doing activities that they were used to do. So they might become socially isolated, more isolated, because they are not able to remember names of the people or not be normal around people due to these impairments. So these are few flagging of signs that a family member could notice during early stages of Alzheimer's. Unfortunately, in India, these early signs most often are mistook as signs of aging. For that particular reason, most of the time at memory clinic, we do not see people with early Alzheimer's disease. Most of the time when they come to us, the disease would have progressed to a level that it is interfering with the task of daily living, like brushing or bathing or being independent by themselves. So these are few things that family members can keep in mind and pick up those early signs and get it checked, because early diagnosis can be really, really impactful to a person with dementia.
Okay, the phase where one needs to understand whether it is an old age problem or an illness or disease, that line, recognizing that is extremely important, is what you're saying. Dr. Venkataramana, how much has the medical world understood so far about Alzheimer's? What causes the condition? Is there a way we can understand who is more vulnerable and who is not?
Thank you at the outset for inviting me for this wonderful discussion. It's very important that Alzheimer's has been a problem for a while. And as clinicians, we also thought it's a part of the aging phenomenon. And we were literally puzzled when it started hitting people at very early age and very rapid course, where they are losing the cognitive functions very quickly. So that is the time the clinicians were awakened and then started looking at it. In the last 3 to 4 decades, I think a tremendous advancement have taken place. So first of all, in the clinical scenario, we now recognize the syndromes very quickly. So when they come to the hospital, so now as been told earlier, that if the family thinks and it's part of the aging and they don't come to us, that's a different story. But other when they come to us, we know very quickly how to evaluate these people clinically, how to pinpoint and look for the other causes as well. So that's the first thing. Now, second thing, there's been a tremendous advancement in the imaging. When you look at the MRI images of the brain, particularly when you fiber tracking, what is called as diffusion tensor imaging of the brain, we see a lot of changes grossly at the structural level. The brain looks very shrunken, a lot of cerebrospinal fluid spaces. The substance of the brain becomes very small, and you can see the brain matter atrophy very significantly. And you also see a lot of ischemic changes of late, in the sense that what we call as small vessel ischemic disease of the brain, which looks like a white patches around the ventricles in the white matter. And there has been a significant reduction in the white fiber tracts in the diffusion tensor imaging. That obviously shows the entire neuronal network is degenerating. So it's a kind of a programmed cell death that's happening, which is at a more than a pace in which normal aging can take place. Now, looking at the causes of this has been puzzling. For a long time, we looked at the blood supply. No doubt, there has been a correlation between the reduction in the blood flow to the brain and the Alzheimer's disease. That's what we see in MRI as the white patches, or the very well known syndrome now as small vessel ischemic disease, where some part of the brain doesn't get blood supply at all, which progresses with age. And of course, a list of or a host of factors that can influence this disease is the diabetes, hypertension, obesity, smoking, alcoholism, toxins, drugs. So many things have been identified. The most important discovery is that a gene-based disease, such for the Alzheimer's, we have discovered in the last 2 decades 3 important genes that are responsible for the Alzheimer's disease. Now, whenever these genes are present, the Alzheimer's disease is starting quite early. It's not after 70s. it can start anytime after 50s, anytime even earlier than that. So these are genetic mediated diseases, which is quite often seen now. And the reason why they are identifying is there is independent mutations. Some are familial as well. Now, this is one. Now, the second important discovery that has happened is the metabolic discovery. We have identified in the neuronal cells why the neuronal cells die, because they accumulate what is called neurofibrillary tangles, which are a sort of inclusion bodies in the cytoplasm, which are made out of a protein called tau protein. Now, this has thrown a tremendous amount of knowledge that the tau protein is getting accumulated within the cell and the cell eventually is dying. Now, there are two possibilities here. One is the protein is being excessively generated. That is one possibility. The second possibility is the generated protein could be normal, but the cell fails to excrete the protein in time. So it starts accumulating, eventually leading to the death of the cell. So that's why it is called a tauopathy. Now, Alzheimer's disease is called tauopathy, whereas the Parkinson's disease, a similar protein has been identified, is called alpha-synuclein. So these two proteins accumulate within the cell, which makes the cell unviable over a period of time. Now, the third discovery, further looking into the metabolism of the protein, there is a genetic mediated induction of the protein metabolism within the cell. And those people who have this abnormal gene, they have this abnormal protein metabolism, which is mediated or facilitated by the gene, so that the protein gets manufactured much more and then it gets accumulated. So that is the third discovery. Now, there are people who harbor the gene, but yet the disease doesn't manifest early, as we see in the normal clinical profile. Sometimes it doesn't appear at all. So how do we explain this? Then we realize that there is something called as the epigenetics. There are factors around, the environmental factors, probably lifestyle related, the toxins and the surrounding factors, ecological, environmental, or including some of those toxins that are induced by the environment, can activate this gene. And in the presence of such facilitating factors, the disease can manifest. And also the profile of illness seems to be dependent on this combination. It's not only the onset of the disease, the rapidity at which the disease can progress also depends upon the combination of these factors. This is the another discovery which we need to look into, how to modify each individual's genetic factors. Now, the other important factor that has come recently is the energy failure. As you all know, brain is totally dependent on the glucose metabolism, glucose for the metabolism and energy. And in all these people, there seems to be a failure of mitochondria, which are the intracellular bodies or the powerhouse of the cell. And when the mitochondria fail and there is no energy for the cell, obviously the cell has to die eventually. So this seems to be the another factor. Now, as clinicians, we have, after the all these array of battery of tests that have been possible today, we have now a list of causes that can cause Alzheimer's disease early. Number one is the genetic. The second one is the tumors. There are certain locations in the brain, they manifest like Alzheimer's, which can totally can be missed out and mistaken for a degenerative disease. A third one is the vascular ischemia. The fourth one is inflammatory disorder. Fifth one is the autoimmune disorders, which has become very, very popular now. And the last but not the least is the paraneoplastic syndromes. Now, the reason why we investigate for all this is that to look for the blood supply of the brain, autoimmune profile, which is possible today to evaluate, genetic testing is possible to evaluate, MRI is possible to evaluate. We also include in the profile a PET MRI to exclude a paraneoplastic syndrome. A cancer inside the body can present like Alzheimer's, or a brain tumor, which is subtle in the brain itself, can also present like a brain tumor. And in addition, we can also look at these metabolic disorders with the PET scan. So the investigation today is to identify a cause, if not exclude other causes, so that we know the treatable causes of Alzheimer's or controllable causes of Alzheimer's, then we conclude them as the idiopathic cause. When we look at the gross pathology, there are certain areas where we call it as memory areas, like hippocampus is the temporal lobe of the brain, which becomes very thin and Though there is a new theory which is coming up, is that in Alzheimer's, very typically, all the childhood memories will be preserved. It's the recent memory that disappears. So the new theory that is possible is that every time, in every situation, we learn and will quickly correlate with our old memory to identify an object or a person or a task. Now, in Alzheimer's, what is lost is a learning rather than a memory. What is stored as old memory still remains, but the learning mechanism is completely lost. When I look at someone's face, they can't read it and learn that so-and-so person and interpret. When you can read something very quickly and identify, then only the association area of the brain can give the information, and then the memory area can identify exactly. This is the 3 steps we identify any object, and next comes the usage of the object. And this is the failure that happens. This is the new possibility that we are looking at now. So the way forward is that to look at all these areas systematically in each individual. That is why it is becoming more of a individual personalized medicine to look at all these factors and correct them separately and collectively.
Right. Thank you, Doctor, for putting that out in such detail and in a way that a layman can also understand. So basically, from Ms. Ramani and Dr. Venkataramana, what we understand is these memory problems or unable to recall or recall learning that has happened previously, to an extent that it affects your day-to-day life, is probably when when people actually go to a doctor and consult. But there are several other factors that you will need to look at and probably look at how somebody could be vulnerable because of these factors that you have listed. Mr. Sastry, coming to you now, you are a senior citizen and did join the active aging group. When did you join this group, and what was your reason for joining the group?
I joined in 2014, that is about 7.5 years back. When I read in the newspaper that Nightingale Medical Trust is going to start a what is called active aging center, I read in the paper and went to the location which the address was given, because I didn't know what is active aging and all that. And I had retired by that time, and I was only taking a walk. That was the only exercise I was doing it. So then I went and inquired. In fact, Ramani was there to guide me, and then I got the details. Then I joined. Then I came to know how the process and the protocol. You want me to just elaborate it just in a small short way. The protocol says physical exercise, mental exercise, and social activities. All the 3 are addressed in an optimum way, and see that we keep healthy. Then my wife also joined. We started, somehow became, by nature, we are little reasonably agile, even of retirement. But this gave a sort of a motivation that we could continue with that agility. And even today at 81, I'm reasonably keeping agile. And that's how
Yes, I'm curious to understand, was there a specific reason that made you want to continue being a member of the active aging group?
Yeah, one is the socializing is there. And when we are doing the exercises in the group, that itself is a little different. Of course, now because of the pandemic and all that, now it is only online. We don't have any opportunity to interact with our friends personally. And so that's why we ensure that we attend only unless some sort of a situation arises, like sickness and all that. And so that's how that is. I'm continuing that desire, and even participated in a few voluntary work for NMT and also my residential campus, elders forum and all that.
Okay, all right. Dr. Venkataramana, coming to brain training, you have explained what happens to the brain of somebody with Alzheimer's, one of it being the brain shrinking. What happens when brain training activity takes place? Is there any change that happens? And is it different for somebody with Alzheimer's and without Alzheimer's?
Before going to that, I would like to just explain the basis why we are looking at the brain training. So fundamentally, as on today, what we understand is that the human being is built on 3 platforms. One is a genetic platform, which is the genes which you acquire from the parents, which is actually a very small number of genes. Actually, it's only about 25,000, pairs. Whereas after that, the bacteria that we colonize inside the gut and outside on the skin and other areas are almost to the equal number of cells that we harbor in the body, and that constitutes the maximum number of genetic component of the human being today. That is called microbiome. So which contributes to nearly 2 lakhs and more genes that we acquire as we move on in the life in various circumstances and in various environments. Now, this is the plot, and the third platform is the epigenetics. Okay, the epigenetics is the platform which is surrounding us, the ecology, the environment, our lifestyle, and the food, all other things and habits, everything comes into that. Now, all the 3 seems to interplay with each other, and that is the one which can influence the origin of the disease, the timing of the disease, profile of the disease, and the way we can respond to the treatment as well. Now, when we were, as far as the brain is concerned, when we were in training, we were told that brain cells are fixed, they're immutable, it cannot be changed, they can only degenerate, they can never improve, so or regenerate. Today, the concept is completely changed. The brain is also a structure where it keeps changing every day. Now, it will be very interesting to note that brain as a microstructure has a neuron, which is the fundamental structure of the brain, which is a nerve cell. The nerve cell has 2 types of connections. One is called dendrites, which they are small projections through which they interact with other cells of the brain. And these ones have a spikes called dendrites. And the long one is called axon, through which it communicates to the body and to the target organs. Now, the dendrites are the ones which receives information every day. And there is phenomenal amount of sensory input with all the 5 sensory organs what we have. And this information comes through the dendrites and passed on to the nerve cell body and then processed. Now, every day, there is so much of information that with each learning and each kind of a training you are trying to do, with each activity, new types of dendrites are forming, new types of networking is taking place, new types of synapses are forming inside the brain. And this is the process which continues all through the life. And depending upon how well you use the brain, the capacity of the brain is so much. In all our lifetime, we will not be able to use more than 7 to 10% of the brain of its capacity. That's why the fundamental rule is just keep using it. Okay. So when we are doing that, we are activating the brain in various forms. The nerve cell is getting activated, the conductivity is getting activated, the neurons, the processes, the synapses, the dendrites, all of them are getting activated. And every night when you are at sleep, there is a process called pruning, where all unnecessary information is removed from the brain and the necessary information is processed, stored in a very systematic way. And that is the one which you are able to recollect and restore and recollect from the stored area. Now, these are the dendrites which disappear and new dendrites keep forming with each activity. So that is the basis why brain training makes a huge difference fundamentally, so that each time you activate the process of formation of new synapses, new dendrites, new connectivity, and new neural network. The stronger the network, the stronger the processing, quicker the processing, the stronger the ability for the brain to store the information. That is the reason the concept of repetition has come in the classrooms. Anything you repeat, you make that substance into a permanent memory. The memory can be classified into 3 types. One is an immediate memory, which you just keep saving every second, but you don't store it, you forget it. And there are certain things, recent memory, where you feel little important, you store it for a certain amount of period of time. If it is not used repeatedly, brain thinks it is not so well required, So it pushes it down and gradually it fades away. Whereas those material which you feel very important, you try to recollect again and again in the form of reading, writing, telling to others. So that gets stored. This is the process of repetition. For example, no one forgets their name because it's been repeated so many times in their life. Even in your sleep or whatever situation, name people will never forget. Similar, the mother language. The mother tongue is always stored. Even in head injury, when the memory area is damaged, the first thing that recovers is the mother tongue. Then the acquired languages will come later. So this is the way the brain starts functioning. So this is the process or the basis on which we propose the brain training, as you keep on using the brain more and more, keeping it more active and more active so that the brain remains active. So if you don't use, what happens? So what happens when it's not used? It is like a Google option. You know, when the artificial intelligence is based on that. If you don't use that page for a long time, it goes down. Whatever is being active page will come up automatically. So the same system is there in the brain as well. The more recently used is coming often and often. So that's why recollection, interaction, talking, singing, playing games, using the memory for different reasons, keep the circuits alive. Now, the question is where the entire memory is stored within the brain, or you have a connectivity outside, is a debate which is going on at the moment. Whatever way it is, but brain can get access to that only when there is a requirement. So you need to keep creating a requirement as often as possible in a healthy way. Now, the second important factor is that a happy person will always have a better functioning brain. This is something which is very important now, what we call as emotional well-being, which is often neglected and quite often very important. Emotions are two types. One is a very healthy emotion, where it is full of love, compassion, empathy, sympathy, that kind of an attitude. Whereas the other side is very aggressive, abusive, and envy, jealousy, fighting attitude. Now, those two systems work through two different parts of the brain. One is called a parasympathetic system, which is always peace-loving, calm, and relaxing. The other one is preparing you for a fight, is a sympathetic system, releasing a lot of adrenaline, aggressive, and whenever, if that emotional balance is not there, you have a more aggressive personality, more and more aggressive chemical compounds are being released. Now, believe me, they are like weapons. It's like a war. Any aggression is preparing your body for a fight. So once it is released, it has to go out and remain in the body for a certain period of time, because they are meant like that to fight the war. So it does significant amount of damage. You cannot have a constructive area when there is a war going on in the country. So whenever there is a peaceful situation, you can do a lot of constructive activity. So this is the reason why meditation, pranayama, all these things have been advocated along with this as part of the mental training, is to keep the brain calm so that your energies are utilized for the constructive activity and not for the destructive activity.
Okay. Doctor, I want to quickly clarify without taking too much of your time. You explained the process that goes on in the brain when new memories are created or when brain training takes place, when the brain is constantly used. Is the process same in those with Alzheimer's?
Absolutely same. So that is the reason why we are now thinking there is a gap. The learning has got three things. One is the attention, attention span, understanding, remembering, storing, recollection, and restoration. So in any of these steps, if there is a gap, so then there can be a problem. Now, normally what happens when a person looks at an object, so the eye will tell only this is an object of the character. And as soon as that you learn that quickly and pass it on to the association area, where it gives two options. It could be a pen, pencil, similar objects. And then your memory area will tell you what it is. Though your memory has this information, if this learning process is disturbed, you cannot get the access to the memory. to identify what object it is. So
Right.
the concept today is that is not only a memory disturbance, it could be a learning disturbance as well. So that the learning process itself is disturbed, so that you cannot identify the people, identify the names, identify the use of the object, identify the purpose of anything at a stage in Alzheimer's disease.
Right. Ms. Ramani, my next question is to you. What are the various activities and training that you provide to the elderly? And is caregiving limited to providing brain stimulating exercises alone?
Right. So when we talk about the activities for the elderly, I would like to bifurcate into two: activities for normal elderly and activities for those with dementia. So we are into both the areas. Now, activities for the normal elderly, I think Mr. Sastry very clearly put it that our active aging program that Nightingales Medical Trust runs, we have been into the space of dementia care for past 20 years now. And during this time period, we saw that dementia does not have a cure, and the kind of burden that it puts on family member is a lot to actually for the family member to go through. The losing a person is one thing. Losing a person is there, but the memory is all gone. They don't recognize their son anymore. The memories of life is not there. So they lose the person at two times. Once when the disease sets in and they start to forget, they lose the person there. And then physically the person is lost once more when they die. So there are two kinds of loss, and this loss sets in gradually, and they have to endure that loss. It's a journey, and it's very, very emotionally, physically, financially, it's taxing. It's really taxing. So when we were in this area, one of the things that we started to concentrate on is there a way that we can actually try to prevent this illness? Though there's a lot of research going on worldwide, we do not have a answer right now that this can prevent. But then there are some modifiable risk factors that have been put together as a list, 10 or 12 of them, and they say that if you somehow try to manage this modifiable risk factors better, the chances of getting Alzheimer's or dementia could be reduced, is what the research says. So what we decided to do is to work on these modifiable risk factors. So these included better management of cardiovascular conditions like diabetes, hypertension, obesity, all that. Then also keeping the brain active through cognitive stimulation, and then also keeping oneself socially active. When we talk about Alzheimer's disease, it's combination of all three things that actually prevents, they say could prevent dementia. So one needs to keep them physically, socially, and mentally active. So when we talk about activities for normal elderly, we try to have all these three things addressed. So physical activity, it could be aerobic, flexibility, yoga, meditation, as the doctor already suggested. All of this were part of physical activity. Then we had cognitive activity. One day they would have a memory activity, another day an attention activity, another day they will have something to do with visuospatial memory, another day only concentrating on language. Then we used to have one day something called as DSD, which is called do something different. So we would just ask the members to come. They don't know what's the activity for the day. We may just ask them to write with their non-dominant hand, or we may ask them to paint, or we may ask them to sing. The problem is that why do we have that sort of session is, if I say, okay, today is painting activity. If you are someone who doesn't like painting and too much into cognitive stuff, you may just not come for the activity, but your brain needs to be stimulated in all the sides. So the session was like, it's a blind session. You just come there and you do what we ask you to do, because that's where you can activate all parts of the brain. As Dr. rightly put it, you need to activate all areas of the brain. There's a saying that the neurons that wire together fire together. So you need to make those new wiring work. So that's how the whole program works. And also we believe that whether it's physical activity or cognitive activity, when you do it in a group, the profound impact is much higher. And also motivation. In our group, we saw the young old was motivated by the old. So the young old will be like, oh, I'm 65. I don't think if I can do it. There'll be an 80-year-old be like, come on, look, I'm running in the treadmill. Come on, better buckle up and start running. Because when I go and tell somebody who's 60 years old, sir, you can do it, they'll be like, come on, you're 30. Don't talk to me like that. But when an 80-year-old tell you better run, there is, there's this small competition that is between the elders, and it's beautiful to watch. And I think one of the things that why Mr. Sastry has been kept going, it is the camaraderie that these people share with each other, these small competitions that they share with each other, that keeps them going. So that's part of the normal elderly who have been doing this activity. And we are very glad that over a period of time, we saw substantial improvement in their sugar levels, then their blood pressure. People started losing weight, they were looking fitter, they were mentally more active, they were more socially coming out. People like homemakers who have never spoken, who have never been social in their life, they started coming, talking about various things. We saw more confident side of themselves. I think if not prevention of dementia, overall the quality of life of these elders have definitely improved at many levels. So that's one thing. And for people with dementia, when we come, yes, they cannot learn new things, but cognitive training, when we talk about brain activity, whether it is Montessori or non-Montessori, it has been proved that they can delay the progression of the disease and keep the person in a particular stage for much longer. A non-active brain can degenerate much faster when we come to Alzheimer's and related dementias. For the brain, there's a saying, use it or lose it. So you have to keep the brain in usage for much longer. So when we talk about people with dementia or Alzheimer's, we design Montessori activities or simple cognitive training that they can do. So our whole idea is to concentrate on their abilities rather than disabilities, because when you allow them, give them activities that they can still do, the engagement is for much longer. And for you to see any kind of improvement or any kind of betterment, if that's the word I can use, then you need to sustain those activities, and that will only happen when the person feel good about doing those activities. And it has to be a routine. People with dementia like a routine, and you have to do it on daily basis. So if 11 to 1 is an activity time, you make sure that every day you expose them to those activities, and those activities should give them a sense of well-being. It should be like, yes, I did it. It could be Montessori, simple A to Z. They might be very well read, but when they finish it, there's a smile on their face, and that will motivate them. Because when we talk about memory, they may not remember that they did this activity, but they will retain the emotions of it. So if they didn't like the activity, next day when they come into this room, they will remember that there was something uncomfortable, and you can see that. So you have to make it as pleasant as possible. And even
Right.
for family members, engagement in this activities gives them also a break, and it also helps in addressing challenging behaviors, which
Right.
actually makes caregiving difficult.
Right. Right, Ms. Ramani. Mr. Sastry, you said you enjoyed these activities. Your wife has also signed up for these activities. Are you seeing a day-to-day change in terms of your cognitive ability? Is there a favorite activity that you enjoy doing as part of the activation group?
It's very difficult to say about the change because I cannot quantify, but I am very much confident. I can tell you that I am enjoying every in 3 days in a week. In each session, there is going to be a change. There won't be any repetition of the same exercise for at least, say, about 8 to 10 sessions. So sometimes it could be mathematical based, or it could be a logic, or it could be English language, like that. The various types of brain exercise games or brain games are there. So the facilitator provides and gives reasonable time and to solve. Some people do it faster, some people do it. All the variations would be there obviously in the class. But I do enjoy it, to put it in a shorter version.
Right. Dr. Venkataramana, as far as these brain training activities are concerned, there are studies that show that they reduce the risk of dementia, but no studies really say that they can prevent dementia or Alzheimer's for that matter. And any sort of care, dementia care or elderly care is for the older population. Is it better to start earlier? The earlier, the better?
Yes.
And can brain training actually be seen as a first step to beat Alzheimer's?
Certainly. The activity to start early is always better because they get used to it. And we always believe that prevention is better than cure. Now, so far, the information, studies, and the data available shows it can certainly postpone the onset of the disease. And the second thing is that the profile of illness can be modified those who have been very active for many years, even the dementia sets in, the progress of the disease is very slow. So they can be in a better stage for a longer period of time, so that the quality of life can be sustained for a longer period of time. So these are the two benefits. We do not have evidence to say that brain training alone will totally prevent the onset of the disease, but certainly it can postpone, maybe it can make it slightly milder form, and this can be augmented, with the many newer things that are coming, like the medications, nutrition, and then, probably the stem cell research is coming up in a big way, where we can augment the brain function either by reactivating the existing nerve cells or inducing regeneration and formation of the new neural network, which is possible today. So that is going to be the future. So I think brain training should be started as early as possible. And the concept of retirement, when you say that retirement, it is a retirement is something, not that they shouldn't do anything after that. I think that is something sometimes they feel very depressed. That I think we need to put it in a very different way in this context. After a superannuation, whoever is fit should continue to be fit and find an alternative way of keeping themselves engaged, rather than, look, I am retired, I don't want to do anything, I just want to sit and relax. I mean, that's not the attitude that we should be inculcated. So this needs a kind of an awareness right before retirement itself. Every employee, every person in the around 50s, we should start this training so that they get used to this system. And by the time this 60 or whatever time they change the job or leave the job, they can continue to be fit physically, mentally, and they can continue to contribute. And the most important thing, if a senior citizen is fit, it's a phenomenal advantage not only to the home, to the society, because they are well respected and their experience need to come back to the society for the younger generation. It can come in many ways if they actively participate. But many a times this doesn't happen. They are being excluded, secluded, and the younger generation thinks that they are smarter than the previous generation with all the gadgets. So in fact, they're wasting their efforts with the gadgets rather than using the brain. So these are some of the things which we need to modify in the future. That's number one. Number two, all the damages have to be curtailed very strictly in terms of any toxic food, alcohol, smoking, physical inactivity, and unnecessary medications, drug abuse, and substance abuse. I mean, these are the things which have to be strictly prohibited, and healthy diet has to be promoted with activity. And then in the combination, I think brain training will work. As a clinician, I would recommend that every family should be aware of this. This is a natural process of aging, but when the natural process of aging gets exaggerated, comes up early or in a faster way, we need to be alerted to seek the medical advice. As clinicians, it's our responsibility to identify and find out the cause by doing investigations repeatedly. First time we might miss or we might not be able to identify. All the investigations have to be repeated in such a way that we should chase a treatable cause. If there is a treatable cause, treat that. If there is a cause that can be corrected, you correct that. And if there is something that can be slowed down, you implement that. Modify the lifestyle and then support them all along, and then so that we can sustain the quality of life. And as I said, gene editing is going to be a tremendous possibility in future. We are almost at the verge of it. So the defective genes can be corrected so that the gene penetrance as well as the gene manifestation can be modified very quickly. And epigenetics is something which we can identify the environmental factors which trigger the disease. I think this is something which we can implement everywhere. And there is a very good study now. Air pollution is related to the Alzheimer's disease. Now, the more polluted the air is, the more higher incidence of Alzheimer's. So some of these newer things are coming up. I think we need to keep learn to keep our environment clean and make our living place very healthy so that we continue to have a very healthy life. Now, the stem cells, as I said, I would like to reiterate that the concept of anti-aging is a wrong terminology. We cannot prevent the process of aging, but the concept is that to keep the brain fit, irrespective or regardless of the age, so that once the brain is active, the brain is the one which knows everything that's happening inside the body, minute to minute and point to point. So that if the brain is active, it knows how to take care of that. All that you need to take care is that see that your brain is healthy and active. So that's the concept behind this. And I think if we can implement this and keep it and keep everyone happy, we are not going to lose anything by smiling and making others smile and keeping our friends happy. And that is the one which will keep us going, gives us more energetic. Probably even mitochondria will work better. And always happy people are very energetic. So obviously their energy levels are high. And this is some of the simple tricks I think we need to implement. At the same time, I would like to emphasize sleep is very, very important. Sleep is the time where brain can restore all the energies, synthesize all the chemicals and required for the day-to-day activity, and at the same time reform and restructure the brain structure also. So these are the things which we need to implement. And as the DSD training has said, breaking the routine is also very important. You need to pose certain challenges to the brain. If you start doing everything in a routine way, you start doing mechanically, and that is supposed to make the brain dull. Now, once in a way, you need to change the challenge. It's like driving in the same road. You don't think. You listen to music, you listen to the song or something, you still reach the point. But if you need to go to some other place, you need to find the route, then you become alert. So this is the concept we need to implement. Breaking the routine is a very important thing.
Right, Dr. Venkataramana, a combination of factors that we need to look at as far as training the brain is concerned, or delaying the onset of Alzheimer's, or for that matter, dementia. I'll ask a couple of questions more to Ms. Ramani and Mr. Sastry and take your closing remarks. Meanwhile, attendees, if you have any questions, request you to put it in the chat box for us. We will take that after two more questions. Ms. Ramani, what are the challenges or limitations as far as caregiving is concerned for Alzheimer's or dementia patients? What more needs to be done? Where is that gap at this point?
Right. What more to be done? I think very, very less is done at present. So we need to go a very long way. When we talk about dementia or Alzheimer's, the awareness about the illness itself is very poor when it comes to our country. According to many published reports, only 10% of people ever get a diagnosis. So most of the time, 90% of people are not even diagnosed. So diagnosis at the first place is the thing where you can actually start helping people. If they're not getting diagnosed, then it is as much difficult. So I think first point is, of course, creating more awareness. There's a lot of stigma around mental health in India. We don't talk about it as frequently as we should. Physical health and mental health, both of them need equal importance. We are okay as soon as someone is 60, we are okay to take a blood wellness complete checkup to understand where our diabetes is, where our hypertension is, my urine is all right, my kidneys are okay, my liver is okay. But do you ever go into a memory clinic to just check everything is fine up there? Not many. And even if they have a problem, there's a stigma attached to going to a psychiatrist or a psychologist. There's a huge stigma. We don't talk about it. So I think we need to start talking about it. If people do have a memory issue, they need to get themselves screened. Now, that's something that we vouch for, that awareness towards early screening is very important. Then only we will have access to timely diagnosis. When we have access to timely diagnosis, the treatment can be started early. And if the treatment is started early, as doctor also suggested, the person can be kept in earlier stages for much longer. The quality of life will be much better. That's again something that we need to look at. And when we talk about caregiving, the diagnosis of dementia itself can be devastating for the family members. They need education about what dementia is, how is it going to progress, what sort of impact it's going to have on the person, it's going to have on the family, what are the things they need to put in place. When we run memory clinic now, there are many questions that people come up with, whether it's related to they cannot sign anymore, or they may not remember their account details, they may not be capable to give consent, there's a mental capacity. All that needs to be looked into. Now there's Mental Health Act which talks about all of these things. So what are we going to do about finances, whether power of attorney we are talking about, all those needs to be put in place. When early diagnosis happen, people can plan all this out. So that's very, very important. And once the diagnosis is established, I think more training, more support to the caregiver across the journey of dementia is highly essential. It's a long enduring journey that the family has to take. So we need support at different levels. As it is mentally and physically exhausting, some sort of respite through daycare centers where the family could leave the person for for the entire day. Now at Nightingales Medical Trust, we run multiple daycare centers where the person can be dropped from morning to evening. We look after them, we give them physical exercise, rehabilitation, and the person can be picked up in the evening. Now that gives a break to the family caregivers to ensure that they can keep the person at home for much longer. Then of course we need some institutional care facility if the family needs some sort of respite, or the behaviors are so much more that they really can't manage at home. Some facilities that can actually provide that platform as well, that is also highly essential. And also talk about advanced care planning once the person is probably unable to eat, or bedridden, or completely dependent, what sort of decisions that needs to be made, that also is essential. And once the person passes away, I think the counseling, that grief, the ability to get out of the role of being a caregiver to leading a normal life, because all these years the only thing the person has known is caring. It's not easy for them that once the person passes away to get out of that role and continue their normal life. It really isn't possible. So the grief counseling and allowing them to get out, all that is very, very important. And I think we are actually just on the tip of the iceberg. There's so much more that we need to do for people with dementia, and this is the numbers that we are talking about in coming times is huge. We're talking about about around 14 million people with dementia in 2050. We are not very well prepared for that, and I think it is very, very important that we start looking into all of this.
Right. Mr. Sastry, quickly, one last question. What is your biggest fear right now, and how do you cope with that?
I personally don't have any fear, but during the presentation, it was mentioned, should we start this early? I think keeping that in view, we should start this training program earlier, because suppose, for example, you take a 20-year boy attending the college and all that. When he wants to calculate even a multiplication, he will start his mobile or whatever it is. And whereas our generation, we know now in Kannada we say Maggi, multiplication table, even now also at this age, we remember it. Like that, the usage of brain is getting being used for something else, but the essential things are being ignored. That's my perception only, I'm telling. So this, like that, there could be some more examples that should be examined, some sort of a mental exercise other than the curriculum, what is there in the class or whatever is in the profession also, that should be examined, so that, because this is not, it is only risk reduction processes, but if the risk has to be addressed at an early age, that I think it affects the population in the longer run. That is my perspective. And one more thing is, that's why I always tell some of my friends, I am not aging, I am growing. A tree growing. That should be our motto, I believe that.
I think it's a wonderful statement to close this session today on brain training and Alzheimer's. We are not aging, we are growing, and that's something that people need to focus on. Instead of outsourcing a lot of our activities that our brain can do to technology, we can take some of them to ourselves. A very informative and interesting session. Thank you so much, panelists, for joining today, taking time out of your busy schedule. Dr. N.K. Venkataramana, Ms. Ramani Sundaram, and Mr. C.V. Sastry. It was a very interesting and informative session. We hope you can join us in sessions on various health topics in the future as well. Thank you so much for joining us here.